Our Ohio Department of Rehabilitation and Correction also recently began conducting wastewater monitoring at Ohio's prisons. We've talked many times about how challenging it can be to prevent spread in any congregate setting, such as a prison, where a positive case in one person can certainly have a ripple effect. Director Annette Chambers-Smith is here with us on Skype this afternoon to talk about how they're using wastewater data to help them, and really also kind of give a report on COVID in Ohio prisons and what the department is doing about that. Director, thanks for joining us.
Good afternoon. Yes, we have been interested in wastewater since about June. In fact, one of the deputy directors came in with a newspaper article and was like, hey, there's this wastewater thing. And we went to OSU's environmental health area and said, you know, is this credible? Should we be using it? And started researching it. At the same time, the US EPA came to us and asked to conduct a study. And so we said, sure, we would love that. So they started in June collecting wastewater at one prison. And then a short time later, OSU started collecting wastewater numbers in 3 prisons. And what we saw was some correlation to what was going on in the prison, as Rebecca just mentioned. So we decided to test every prison every week. And we've been doing that since the first week of September. And what we're finding is there's a relationship between what's going on in the prison and the wastewater, and the early warning aspect of it does appear to be happening for us. I don't think we all have enough data right now to say conclusively exactly how many days it is, but yes, it looks like it's about 7 days. And that's precious time for us to plan. So we use it as an early warning system, and so far we've been using it to do things like decide how many cohorts can be together, whether or not we're going to have visiting, just a whole host of decisions that are made that can make the prison safer if COVID is going to be coming there. But now I'm putting out an executive order that will require staff to be tested when certain indicators like positivity of staff, positivity of the incarcerated adults, or the wastewater indicators show that there's a problem with COVID in that prison. We would not require testing if there's not any indicators, but if there is, and wastewater is a leading indicator that happens before hospitalizations, before the cases come through testing, that would help us control things, because we know that COVID comes into prisons from the outside, but once it gets in there, it's very difficult to stop it. So requiring staff to test at the point where we know that that would be useful, that's what the executive order is about. And then every other prison will always have staff being able to do voluntary testing. So we're going to start the mandatory testing on October 6th at only those sites that trigger, you know, these indicators. And wastewater is definitely an important one because it is the only one that's really a leading indicator.
And you want to tell us a little bit about what the protocol, you told me a moment ago about what you're announcing today, but what's been the protocol as far as testing? How do you do that?
So in the past, we've tried several different methods of voluntary testing, such as having the National Guard help us test on site in the parking lot, setting up contracts with local hospitals near the prison. So since the beginning of COVID, we've had different ways for our staff to test, as well as they can take advantage of any of the testing that goes on in the community. But to be frank with you, when we have a staffing shortage and people are working double shifts, the last thing they're trying to do is go somewhere in the community and get a test, or if they have to work their days off. I mean, we have a very hardworking staff. They've been doing great work, and what we want to do is bring the testing to the facility all the time so they can get it while they're on duty. They don't have to miss a beat or take any of their personal time to do it. So we're really transitioning from just like catch as catch can and using contracts in the communities to having it on site, and the staff being able to do it when they think they have symptoms, when they're concerned about exposure, they can do it. And then also if we have a problem, we'll require it.
You want to tell us a little bit, I think we talked about Mansfield. We've got some cases there, I believe. Or maybe you just give us an overall report of all the prison facilities. You don't have to take them one by one, but just give us kind of a summary.
Well, we do have 79 staff members who are currently positive for COVID, and we have 266 people that live in the prisons that are currently positive. 3 of our prisons make up the majority of the positivity. That's Richland Correctional Institution, which you just asked about, the Correction Reception Center, and Madison Correctional Institution. Those 3 prisons have the majority of the positive cases. We have about 1/3 of our prisons that don't have COVID at all, not in their wastewater, not with their staff testing, nor with their incarcerated adult testing, which is great. And then, you know, the next thing we're going to be doing is flu shots. So we want to make sure that our staff and our incarcerated adults are vaccinated so that we don't have to use resources or have additional people sick in confusing flu symptoms with COVID symptoms. We don't want to be fighting on all fronts, so we're going to really try to make vaccinations accessible. Again, we'll do those on site for our staff. We are partnering with a local provider to come in, do the shots at different times, different days, and then of course our medical staff that work in the prisons will provide the vaccinations to all of the incarcerated people. So multi-prong attack that changes with the seasons, including an environmental aspect that we've been pursuing.
Tell me a little bit, I know you've been doing some work about airflow inside the prison. You want to talk to us a little bit about that?
Yes. In April, our HVAC experts started changing the air circulation between the fresh air outside and the recirculation to have more fresh air coming from outside, sometimes up to 100% if the system could take that. That was the beginning of starting to look at environmental factors. After we'd already done social distancing to the extent possible and wearing masks and gloves and, you know, washing your hands and all the different things we do to try to fight COVID that a person is responsible for, we then turned to start looking at, well, now what we can do with our environment. So that's how the HVAC system started working. And then we engaged an environmental health specialist from OSU named Dr. Weir, and he has been working with us to choose ionization infiltration systems. Those filtration systems are installed at 5 of our facilities, and they're supposed to, you know, obviously clean COVID out of the air. And OSU will be doing testing to make sure that they do. And if they do, we'll buy more for more facilities. But there's been a lot of magic beans during COVID, so we don't want to buy too much of something without really making sure that it has efficacy. But according to Dr. Weir, this system is the one that's most promising out there. So that would clean the air. And we put that in places like where we have high acuity people at those 5 sites. And we did that in April. And then in May, we changed out our filters to have the highest MERV rating that the system could handle. So that's an additional filtration measure. And now we're in the process of procuring portable air filtration systems for additional filtrations in places like the visiting area or entry or the medical area. So we're just really trying to take care of our physical plant as well, because you know, when winter comes, everybody's going to be inside all the time, and we want to make sure we have the very best chance we can have.
Thank you very much. Good to have you on, and we'll get a report in a few more weeks. But thank you.
All right.
Appreciate it,
nice
Director.